Moving on to our next topic of discussion, which is the parapharyngeal abscess. As you know that on the either sides of the pharynx is a space known as the parapharyngeal space. An infection or separation in this particular space will lead to parapharyngeal abscess. Right? This particular space is itself connected with different spaces. It is not only connected with a single space, it is connected with different spaces like peritonsillar space, submandibular space, masticator space, parotid space, superficial and the deep temporal space, right? So infection, if spreads from here, then it can lead to serious complications. Infection from parapharyngeal space can occur from pharynx, we all know. It can also occur from teeth, ear and other spaces and external trauma. The clinical feature are actually divided by anterior compartment and posterior compartment. This is a mentioning point that this space is divided into an anterior compartment and a posterior compartment by the styloid process and the muscles attached to it, right? So the anterior compartment infection lead to the prolapse of the tonsil or the tonsillar fossa, trismus, and the external swelling behind the angle of the jaw, and the posterior compartment produces bulge of pharynx in the posterior pillar, paralysis of nerve, swelling of parotid region. Diagnosis is actually made by CT scan and MRI. Complications are just a read, and treatment involves the systemic antibiotics and the drainage of abscess. Now, for example, a patient is presenting to you with odynophagia, drooling of saliva, fever and headache, right? And there is no deviation of the uvula, right? And there is no lymphadenopathy, then you will be giving a diagnosis of parapharyngeal abscess, right? Because the person is having no deviation of the uvula and he or she is having no lymphadenopathy and drooling of saliva and odynophagia is occurring. So this is it. Hope you understand. And this is a minor topic which is known as the masticator space. It is present between the two layers of deep cervical fascia, and this space itself is having further three spaces, which is the mesenteric space, temporal space and the pterygomandibular space. These are the contents: masseter muscle, pterygoid muscle, temporalis muscle, ramus of the mandible and the posterior part of the mandible, maxillary artery, inferior alveolar nerve. Dental infections, particularly of the second and third molar teeth, are most common source of abscess formation, right? One more important thing is that the danger space, right? It is extending from the base of the skull to the diaphragm, and it is present between the prevertebral fascia and the alar fascia, right? Hope you understand.